Good morning, good afternoon, good evening, wherever you are in the world. A very warm welcome to Meet Menaca. Today, it's episode 107. We are going to be talking about breast cancer awareness with Dr. Nalinie Joharatnam-Hogan. She's got an MBBS, BSc, MRCP, and MD. I'm sure the list goes on. Before I introduce the speaker further, I just wanted to introduce our talk show. Meet Menaca Celebrating You features experts in their respective fields and real people sharing real stories to create a positive social change. We would be delighted to have you on our show, which live streams airing every Sunday at 2 o'clock London time. Please support our YouTube channel where you can go back and find all the resources of the past 105 speeches from experts who have spoken on various things from health to social issues and finance. Why are we talking about breast cancer awareness today? Firstly, this month, October, has been dedicated for breast cancer awareness. And so what better time to talk about it? This is held in October every year. It was created in 1985 to promote the screening and prevention of this disease. In the statistics, it's appalling. In women, on average, there are almost 55,000 plus cases each year. And 18% of the breast cancers were in women under 50. And 82% 50 or older. So it is pretty prevalent. So I think it should be talked much more and more widely. And it is the most common cancer in the UK, representing 15% of all new cancers. I truly believe prevention is better than cure or intervention. So let's find out more from our expert, Nalinie Joharatnam-Hogan, to talk about this. Dr. Nalinie is a medical oncology specialist registered at the Royal Marsden Hospital. She studied medicine at Imperial College London and undertook her Bachelor of Science degree in Japan. She recently completed her MD research degree at University College London. During this time, she has developed a large international cancer clinical trial looking at the use of aspirin in early stage cancer. She has numerous papers published on the subject of cancer in a number of cancer journals, as well as presenting cancer research at numerous international conferences. She has furthermore developed national guidelines for patients with cancer and diabetes. So it's a huge privilege and honor to have Nalinie on our platform today. A very warm welcome to you, Nalinie.
Thank you for the introduction.
Thanks, Nalinie. Firstly, I just want to know from the expert point of view, what is breast cancer and who gets it?
So to answer that question, breaking it down really simply, what is cancer? So essentially cancer is abnormal cells that develop in our body that grow and divide uncontrollably and deposit in an area of the body. So in this particular example, breast cancer, they deposit in the breasts. And most commonly, they develop in the milk ducts that we have in our breasts. So when we're talking about breast cancer, we might just think it just involves the breast, but also there's the armpits, and that's involved, and also the area under the collarbone. And that's because when we're thinking about breast cancer that might spread, lymph nodes, which are glands that we have under the armpit, under the neck. These are glands that have inflammatory cells or cells that fight off infection. If you have, say, a cold, you might notice your glands are up. These are your lymph nodes. But in some circumstances with cancer, a cancer cell might deposit in your lymph node and you might feel a lump that is actually a cancerous lymph node rather than a normal infection. That's the sort of what breast cancer is. But when we delve in a bit more, there are different subtypes. So there are tens of different types of breast cancer, but if we divide it very simply, the most common subtype of breast cancer is a hormone-positive breast cancer. So what that means is the cancer is is caused by the estrogen and progesterone hormones that women have in their body, and that encourages the cancer to divide. Now, slightly more rarely, there's something called a HER2 positive cancer. So that's a specific protein that some people have that can cause the cancer to divide. And the third type is called a triple negative breast cancer. So you don't have any hormones that are driving it. And the reason this is relevant is that might dictate what kinds of treatments you might be offered. So who gets it? So you sort of summarized in your introduction, it's incredibly common. 15% of all newly diagnosed cancers in the UK are breast cancer. And in a woman's lifetime, 1 in 7 women will develop breast cancer in their entire life. So that's quite significant. But we think it's just in women. There are a small proportion of men who can also develop breast cancer. Now, it's rare. If we had 100 people in the room who had breast cancer, one of those people will be a man. And that's because men also have a bit of breast tissue underneath the skin. Particularly if you're a bit overweight, you might have a bit more breast tissue. So, and breast cancer in men is considered the same type of cancer as breast cancer of women, treated the same. But yeah, so that's sort of, if we're thinking about what it is and who gets it.
Thanks, Nalinie. It's so important. 1 in 7 women should be noted, and I think people should pay more attention to it for sure. Thank you so much for enlightening us with that. So what are the symptoms of breast cancer? What should people look out for?
So I think the one that we all think about or worry about most is if you were to notice a lump or a thickening in your breast. So it's worth pointing out that not all lumps in the breast will be breast cancer. In fact, most lumps that you might feel will be benign. So you might have a cyst in your lump. Some women just naturally have lumpy breasts, particularly around the time of your period, if you're still having periods, or a variation during your menstrual cycle. You might get lumpiness that comes and goes. That kind of lumpiness is not something we would worry about. But if you did notice a new lump that was persistent, that would be something that would be a bit of a worry for cancer. Not just in your breast, also in the armpit. I mentioned earlier about lymph nodes or lymph glands that you have in your armpit. So if you were to feel under your armpit and you notice a lump, it would certainly also be a reason to consult with your doctor and get examined. So a lump is probably the most common thing we think about. A change in the size or the shape or the feel of your breasts. So probably, I'd say the majority of women have asymmetrical breasts. One side is always larger than the other. So it's important that you're aware what's normal for you. But if you were to notice that it was different in shape or size or look, that would be significant. And again, a reason to go consult with your GP or doctor. Changes to the skin. So a puckering or dimpling in the skin, a rash or redness. So we sometimes describe it as looking a bit like orange peel. So if you imagine looking at an orange, it's sort of a bit rough in texture and there's little dimples. That might be an indication, and again, a reason to get checked. Not just on the breast itself, but also thinking about the nipple. So if you notice leaking from the nipple, of course, if you're pregnant or breastfeeding, that might be normal. And also worth pointing out that leaking from the nipple might be another medical condition. In fact, it's more likely to be something else than cancer. But again, that would be a reason to get checked. And finally, a change in the position or how the nipple looks. So if you notice a nipple is sort of inverted, pointing inwards, or is not in the same position as the other nipple, again, that would be a reason to get checked. So more often than not, these symptoms are caused, as I mentioned, by other medical problems. But if you have any of those, that would be a reason to see your doctor. Breast pain is something that people worry about. It's very uncommon for pain in the breast to actually be caused by cancer. Most of us at some point will have had pain in the breast and it comes and goes. That being said, if you had pain that was persistent, it would still be a reason to be checked. So they're the sort of main symptoms that when we're talking about breast cancer.
Thank you so much, Nalinie. It's important for all of us to know about these things, isn't it? And many of us actually don't pay so much attention for these things.
Exactly.
So, thank you. What are the different stages of breast cancer? The big C is a huge thing, and people, including me, most of us would worry. What are the stages of breast cancer?
So essentially, when we're thinking about stage, that essentially means how big is the cancer and has it spread to another part of the body. So a doctor might use stage to help them decide what kind of treatment they might offer you and help us to determine what your risks or severity of the breast cancer is. So there are sort of two main ways we might look at stage. One is something called your TNM. So T stands for tumor size. How big is it? A 2 centimeter lump is actually considered reasonably small, compared to a 4 centimeter lump is considered quite big, and that would put your stage and your risk a bit higher. N is nodes. So we mentioned lymph nodes. Are your nodes enlarged and do they have cancer in them? Because if they do have cancer in them, that suggests you're at a slightly higher risk, that the cancer has moved already from the breast to a lymph node. So it's already started to make a movement. And finally, M. So M stands for metastases, which is another word for spread. Has it spread to another part of the body? And the common organs that a breast cancer might spread to are the liver, the lungs, bones, and brain. So when your doctor has all of this information, they can put together a stage, which is a number, 0 to 4. So 0 essentially is you have some cancerous cells, they haven't invaded, they're not deep, they're very superficial, and your risks there are really, really low. And that goes up to 4, which is the most sort of serious risk. So 1 is considered very early, it's very small, as I mentioned, less than 2 centimeters. 2 is still considered an early stage, but it might be a bit bigger. 3 we would call locally advanced. So it's bigger still. It might have moved to one of these lymph nodes. It might have spread to the skin. So you might notice change in your skin, like a rash or this puckering, dimpling. And finally, 4, stage 4, other names for that are advanced cancer, secondary breast cancer, or metastatic breast cancer. And they all mean the same thing. They've spread to another part of the body. So 1 to 3, the aim of treatment of these early stage breast cancers is to cure. We want to get rid of it, and there are lots of different types of treatment that we might give. Stage 4, because it's more advanced, and usually in that case, we can't cure it, but it's all about controlling that cancer.
Thanks, Nalinie. It is important to know the different types of stages, because it doesn't mean just because somebody told you that you have cancer's ultimatum. There are different stages. So I think that's the reason it's important for people to know that. Prevention is, of course, better than intervention. We all know that. We sometimes forget it. So what are the risk factors for breast cancer, and what can people do to avoid it?
So the way I like to think about your risk factors are things that are changeable, reversible, and factors that are just part of our makeup that we can't change. So if we focus on those changeable, reversible risk factors, one of the more common potential risk factors are being overweight and obese. So women who are overweight, particularly after you've undergone the menopause, have been shown to have a higher risk of breast cancer than those who are not. And that's the same for men as well. So then when we're thinking about what we can do to prevent it, that's something that's, we can try and lose weight, keep healthy, keep physically active. And again, there are lots of studies that show that physically active people have a lower risk of breast cancer. And these activities can be just having a physically active job. So if you're on your feet all the time, that counts. If you like doing exercise, if it's walking, cycling, any sport, that counts. But even chores around the house, so gardening or cleaning, anything that gets your heart rate up, makes you feel a bit sweaty and a bit out of breath, all help with your physical activity and all help with weight loss. Other risk factors, so that are reversible or changeable, are alcohol. So we know that drinking alcohol can increase the risk of breast cancer. And with each extra unit of alcohol that we drink, your risk goes up. So when we're talking about a unit of alcohol, that can be as little as a little shot of a spirit or a small glass of wine. That's 1 unit. A large glass of wine is 2.5 units. So in the UK, at least, the government guidelines suggest that we should only be drinking 14 units of alcohol per week. That's not very much. So if you're having 1 large glass of alcohol every night, suddenly you're over that threshold of what is considered, a safe amount of alcohol. But that certainly, if we're trying to reduce our risk, is something we can do to lower the risk, cutting down on alcohol. So other risk factors, there are some medications that can put your risks up. So the contraceptive pill is something that younger women particularly might use to reduce your risks, reduce the likelihood of falling pregnant. Now, if you take the pill and then stop taking the pill, your risks of breast cancer go back to normal after 10 years off the pill. So we don't tell women don't take the contraceptive pill, because most women who take it are younger, in their teens, 20s, 30s, and your risk of breast cancer is reasonably low when you're younger compared to an older woman. But it's just something to be mindful of when you're making that decision about contraception. The other medication that can increase your risk of breast cancer is hormone replacement therapy. So women who are going through the menopause can get lots of symptoms, hot flashes, mood changes, just feeling generally low in mood. And hormone replacement therapy is a really effective treatment to try and tackle some of those symptoms. But we also know that it can also slightly increase your risk of breast cancer. So the longer you take hormone replacement therapy, the higher your risk. So if you were to take it for 5 years, your risk is much higher than if you were to take it only for a year. And again, similar to the contraceptive pill, if you were to stop taking it, so 10 years after you stop taking it, your risk reverts back to normal. So I wouldn't say don't take hormone replacement therapy if that's something that is useful for you, or if you have significant symptoms of menopause, but it's about weighing up that risk balance. You know, it's important to talk to your doctor. If you have lots of symptoms of menopause and you think the benefits of HRT or hormone replacement therapy outweighs your risk of cancer, then it might be important for you to take it. But if you're somebody who has a high risk of breast cancer already, actually we might say the risk outweighs the benefit. Or if you are going to take it, perhaps take it for a shorter time period than, say, taking it for 5 years. So they're sort of the main, going back to the question, the risk factors, the main changeable risk factors, being overweight, alcohol, some medication, and being inactive. And then thinking about factors that we can't change, that are just part of our makeup. So being older, unfortunately, the older we get, the higher your risk of cancer. And that's probably for all cancers. So particularly in women over 50, your risks of breast cancer are higher than, say, a woman under 40. And there's unfortunately nothing we can do about that. But being mindful of that and being breast aware, particularly if you're an older woman, is incredibly important. Other things we can't change are your family history. So if you're somebody who has a mother, a sister, a daughter who has breast cancer, so somebody in your immediate family, they're what we call first-degree relatives. Your risk of breast cancer in yourself is slightly higher if you have a first-degree relative. Also then, if one of those relatives is young, that will put your risk up a little bit higher. Or if you have a close relative as well as a first-degree relative, so you have an aunt who also has breast cancer and a sister, for example, your risk is even higher. So that would be a reason to maybe go see your doctor and ask them, should I be tested for an inherited gene? So if you had a first-degree relative who was under 50, or you had 3 close relatives, aunts or grandparents who had breast cancer, that would potentially put you in an eligibility category to have a blood test to check if you have one of these inherited genes. So you might have heard of BRCA, BRCA1, BRCA2. These are the common hereditary genes that you might have. Now, it's not common. So if we have all the women who have breast cancer, only 2% of those might have these underlying inherited genes. And the reason it's important to check if you have an inherited gene is you could pass it on to your children, but also your lifetime risk of cancer is much higher. So if you have a hereditary gene, you have about an 80-90% risk over your lifetime of developing breast cancer, but not just breast cancer. It puts up your risk of cancer in the ovaries and also some other rarer cancers like pancreatic cancer. So those are reasons that if you do have a family history, it's important that you talk to your GP and say, do you think my risk is high enough to check for a gene? Other risk factors that we might not be able to change. So diabetes is one of them. Now, there are lots of studies looking at the links between diabetes and cancer. What we don't really understand is it diabetes causing cancer? Or is it the fact that people who get diabetes also have the same kinds of risk factors as people who get cancer. So you might be overweight, you might be somebody who has a poor diet, doesn't exercise very much, and is a smoker. And those risk factors for diabetes are very similar to the risk factors for cancer. So that's what we don't really understand. We don't think it's diabetes causing cancer, but rather they're linked in other ways. Other potential non-changeable risk factors, having denser breast tissue, that's just something that's part of your genetic makeup. Some women have more fatty, soft breasts, some women have denser breasts, and those women who have denser breasts are shown to have a slightly higher risk of breast cancer. I mentioned earlier about hormone-positive breast cancer, so it being driven by estrogen, and there are some things in our makeup that mean we have more estrogen. So women who start their periods early and have a late menopause, women who don't breastfeed or don't have children, might have more estrogen in their body. So it might put up your risk of breast cancer very, very slightly. Again, that's not something we can necessarily control. Ethnicity, something we can't control. Actually, women who are Caucasian, so white women, have a slightly higher risk than other ethnic groups. And the final thing is diet and smoking. Actually, there isn't much evidence that suggests diet and smoking is linked to breast cancer, unlike other cancers. So we know that eating lots of red meat, fatty foods, smoking has a big link to bowel cancer and a big link to lung cancer. The link to breast cancer is a bit more tenuous. But we know just generally being healthy, being active, cutting down alcohol, these are all things that we can do to try and reduce our risk.
Thank you so much, Nalinie. I'm sure it's a lot to think about. No more glass of wines for every day, for sure.
You can drink, just in moderation. That's the main message.
Sure. Thank you so much. Yes, you went through very contemporaneously every single thing you have told us what not to do. Are there any protective factors? Or can you say something about how people can reduce the risk of it?
Yeah. So apart from the things I've already talked about physical activity, alcohol, breastfeeding, the other things we can do as an individual to try and reduce our risk of breast cancer. So really it comes down to this topic title, being breast aware. Breast awareness, essentially that means getting to know what your breasts look like and feel like. And this might change at different times of the month. And so knowing what's normal for you. Here in the UK, at least, the NHS, our health system, we have a kind of 5-point plan of how we can be breast aware. And that involves, so point number 1, just knowing what's normal for you, whether that means your right breast is bigger than your left breast, or your nipple is slightly lower on one side than the other. Looking at and feeling your breast, that's point number 2. So it's really important that you look in the mirror and you see what they look like, but also feeling how they might look like. And I mentioned already that for some women, having lumpy breasts is normal for them, particularly at a time of the month or particularly around your periods, and that might fluctuate during your cycle. Knowing which changes to look for, that's point number 3. And that ties in with when I mentioned all the symptoms of breast cancer. So I'm going to just say them again to sort of summarize and drum it in. Looking for a lump in your breast or your armpit, looking for a change in the size, the shape, or the feel of your breast, looking for changes to the skin, so puckering, dimpling, rash, redness, looking for leaking of fluid from your breasts, that's if you're not pregnant or breastfeeding, and a change in the nipple itself. So they're the things that we need to look for. The 4th point that the health system here suggests to being breast aware is seeing your doctor if anything is unusual for you. So everybody is different. One thing that's abnormal for one woman might be normal for another. But if you think that something is unusual for you, that is persistent and can't be explained by something normal for you, that would be a reason to talk to your doctor. And finally is attending screening when you're 50 and over. And I don't know about other countries will have different programs, but certainly in the UK, we have a breast screening program. And that's another way that you can be breast aware, by going to the screening. So just going back to examining your breasts to be breast aware. You don't need to do it every day or every week, perhaps monthly, setting a reminder on your phone, but perhaps changing the time of the month that you do it, just in case there are changes in your cycle. Doing it perhaps in the shower, so you've got soapy hands and it's easy then to feel your breasts, making sure that you also feel your armpits. That's really important. When you imagine it, if you imagine the breast is a circle and you divide it into 4 quadrants. So on each side, you have an upper quadrant, right and left, and a lower quadrant, right and left. So making sure you use sort of circular motions in each of those 4 quadrants. Then you have a sort of triangle that leads from your breast to your armpit. Here, that's important to feel, and then the armpit itself. So if you do that in the shower and it just becomes normal for you, and then you climb out of the shower and you look in the mirror and have a look, that's how you can examine yourself. And nobody will know your breasts better than yourself. You'll be better at picking up a lump than, say, a doctor, especially if, for example, you have larger breasts and it can be hard to feel for somebody else. That's something that you will know better than anybody. So that's the best way I can describe how we can be breast aware and what we can do for ourselves to prevent it, or at least catch it early.
Thank you so much. That's something I think, like in your words, it has to be jumped because, particularly in some cultures, it's not very common. I think we were not taught from a young age that it is something normal and it is very good for you to do it. So I think people like you telling it as an expert will make a difference, I guess. Thank you so much, Nalinie. One of the main reasons or intentions behind bringing this Breast Awareness Month in October was screening. And you said as well, screening is so important. So is it just only one screening method, or are there different screening methods for breast cancer?
So the main method for screening is something called a mammogram, which is a type of X-ray. So at least in the UK, the screening program that is offered here is for women aged 50 to 70. Every 3 years, you're invited to come up to, sometimes they're mobile units or sometimes in the hospital, where you have a mammogram of both your breasts. In some parts of the country and some other countries, the screening program is actually for women aged 47 to 73, so a bit of a broader invitation. If you hit 70 and you want to continue having screening, but you're not automatically invited, all you need to do is go to your doctor and say, I want to continue having breast screening, and they can refer you to your local screening program. If you're under 50, screening isn't done because, one, it's more difficult. Mammograms are not very sensitive in younger breasts, which are just naturally more dense. But also, as I mentioned, you're more likely to get cancer when you're older, breast cancer when you're older. So we don't want to put lots of young women through breast screening unnecessarily. And that's why the 50 to 70 range has been chosen. Why we do breast screening is not to prevent you from getting breast cancer. It's really to pick up cancers as early as possible. So before you even pick it up yourself, before you can feel it or see it. And the benefit of picking it up early is it means that treatment is much more effective and we're more likely to cure you, and also reduce the overall number of deaths from breast cancer if you pick them up when they're very small. So I think the statistic for screening is if we screen 1,000 women, the breast cancer screening program picks up 9 extra cases of cancer than if we just wait for you to present to your doctor, when you're more likely to pick it up later. So that's the kind of the benefit. There are potential risks of screening. Screening is not a perfect tool. So with any investigation we do, you might miss some cancers. So that's something called a false negative, where the test results come back saying everything's clear and you might have a cancer. And that's the nature of any investigation. You might have a false positive, the opposite, where the test comes back and it says there's something abnormal there, but actually it's not abnormal. And that means you're put through further tests unnecessarily. Overall, however, when we're talking about breast screening, the benefits of screening far outweigh any harm. We definitely pick up more cancers than if we just don't have screening, and we definitely prevent deaths if we don't have than if we don't have screening. So what might happen is you have your mammogram, then usually it might take 2 weeks for your results to come back, usually a letter in the post. Either it will say everything's normal, nothing to worry about, come back in 3 years' time, or it will ask you to come back, so a call back. About 4% of women, so 4 in 100 women might have a call back. And of course, that's really worrying if you have a call back. But for most of those women, it's not cancer. It's just that something's a little bit unusual on the scan. They might want you to have another scan. They might want you to have something called a magnified mammogram, which is a mammogram in a bit more detail and a bit clearer, that might tell us one way or other if it is cancer or actually just something benign. Or they might say you need an ultrasound, which is like a jelly scan, like, if you're pregnant, you'll have an ultrasound scan, same kind of scan, or a biopsy, so a small needle to pick out some cells to send it off to the lab to look under the microscope and see really truly is there cancer or not. Of course, it's always a worrying time, but as I mentioned, for most women, it's going to be negative. But it's really important that, as I mentioned, it's one of our 5 things that we can do to be breast aware by going through this screening program.
Sure. Thank you so much. The only thing I was listening to you and I was thinking, is there the frequency of mammogram? Does it vary with the age or the risk?
It doesn't. So it's every 3 years from 50 to 70 or older. If, however, you have a family history or you're considered to have a higher risk because you have one of the genes, you might have it more frequently. So if you have a high risk, you might have mammograms every year. And if you have the BRCA gene, these inherited genes, you might start your screening as young as your 20s. And instead of a mammogram, you might have yearly MRI scans. So MRIs are the big tunnels, really noisy, they're quite claustrophobic scans, but they're better for younger women because they can pick them up better than mammograms. They're really the only variation. Otherwise, it's 3 yearly. And the reason being, if you don't want to put women through unnecessary stress or unnecessary investigations too frequently, we won't necessarily pick up more cancers if we do it that way. There's also a very, very small risk of having too many X-rays, and X-rays have a bit of risk themselves, a bit of radiation. Now, I'm not saying that to worry people. If you put it into context, if you fly a transatlantic flight, so you go from the UK to America, that's the equivalent of having 5 X-rays. And we don't think anything of it. You just hop on the plane. So the risks of radiation from a flight or from an X-ray are very, very low. But we don't need to unnecessarily have too many scans if we don't need them.
Thank you so much, Ernie. I am going to go through the rest of the things I wanted to clarify. But as you speak, your passion for this comes through really strongly. So I just wanted to ask, is there any particular reason you went into this particular field of oncology? So I'm not a breast cancer. I'm at the moment general oncologist. I'm a registrar. But the reason I think I chose cancer itself is it's such an important subject. There's so much we can do. There's so much research and so much change. It's a field that's changing all the time. There are new treatments all the time, which is really encouraging. Everybody's scared of the word cancer and what it means, but actually there's so much coming out in terms of treatment and potentially cures all the time. And that's why it's something I want to be involved in. If we can make a real difference to people who do have what is a very scary diagnosis, then that's something I want to be involved in and help make that difference. Thank you so much, because I couldn't help but ask the question. Thank you. Unfortunately, some people do get diagnosed with cancer and they have to go through that journey. Can you explain what are the treatments available for breast cancer, please? Yeah, it's a quite hard question to answer because it's so broad. The treatments are so varied and we have so many different types of treatments. That very much depends on the stage. If we break it down into early stage cancers that we can cure, the kind of main treatments that we want to do are firstly surgery. That's the main thing. Now, if your cancer is quite small, you might just have something called a lumpectomy. We just cut out the lump and you preserve the breast.
If your breast cancer is a little bit larger, or if you have more risk factors, you might have a mastectomy, which is where we remove the entire breast, which sounds terrifying, but it's something that's done, has been done a lot for many, many years. And nowadays, surgery is so advanced that you can reform the breast, put in implants, refashion it so it looks exactly the same as it did before. And you can make the scarring, underneath the breast fold so you can't even see them, or around the nipples so you can't even see them. But the main the bulk of treatment is surgery. And then everything else is complementary. So chemotherapy, that might be given before your surgery or after your surgery. The reason it's given before is if you have a slightly larger breast cancer, it can help shrink it down, and that will make surgery a lot easier. And the reason we might give it afterwards is we hope that surgery has taken out all of your cancer. But for some people, there might be a little bit of cancer cells left behind. And therefore, the benefit of chemotherapy is to mop up any residual cells left behind. Other treatment that might be given is radiotherapy. So again, if you have a larger cancer, after you've had your surgery, you might have 3 weeks every day of having radiotherapy. And thereafter, you'll then have chemotherapy. And finally, sort of more targeted treatments. So I mentioned at the beginning of the talk, the different subtypes: hormone positive, hormone negative, triple negative. If you have a hormone positive cancer, the best thing we can do is try and block the hormone, block the estrogen, which is encouraging the cancer cells to divide. So you might have heard of the drug tamoxifen or anastrozole. These are the common drugs we use, and they'll be offered to women for 5, sometimes 10 years or even longer after your cancer, with the aim of keeping the estrogen levels down. And it's sort of almost artificially pushing you into menopause if you're premenopausal, to stop that driver. For some women, we also have targeted treatment. I mentioned HER2, and you don't need to know all the details, but this is something that's driving the cancer, and we can block it with an anti-HER2 drug. So there's so many different types of treatment. It's also worth knowing that, after you've had your breast cancer and all your treatment, you're not then just sort of left to go home and fend for yourself. You're then followed up very regularly for a number of years, where we would examine you in the clinic. You'd have regular scans, so annual mammograms or annual scans, just to pick up any recurrences. And would also, again, if you were to be diagnosed with breast cancer, it's still important to be breast aware and continue to examine yourself, even if you've had the breast removed. And that's because you might have a recurrence in the skin or surrounding area. So it's really important you understand what is your new normal after you've had surgery. So that's sort of just a brief summary of treatment. Of course, if you have more advanced cancer, treatment's very different. And I could talk about that non-stop, because there's so many different types of treatment for advanced cancer too.
Can you just mention 2 or 3, please? Sure.
Yeah. So if we're talking about just secondary breast cancer or stage 4 or advanced breast cancer, they're all the same terms. It's important to point out that the main goals of treatment are not to cure it. So in some women, we might be able to, but for the majority of women with stage 4 advanced cancer, we can't cure it. So really, we're trying to control it with the treatment, trying to improve our symptoms, try and improve our quality of life, and try and live as long as possible. And many people can live a normal life for a number of years with advanced stage 4 cancer. And so the treatment we're giving is usually medication treatment. So it might be chemotherapy, it might be targeted hormone treatment. And you might be given, like how if you had diabetes, you're on a medication for many years. We sort of think of stage 4 cancer a bit like that. It's a chronic condition, and we're giving different treatments to try and keep you going as long as possible and keep it under control and stop it from spreading as long as possible. Just talking a little bit more about that, when we're thinking about secondary breast cancer, I think people can often get confused about the terminology because there's so many different terms: stage 4, secondary breast cancer, metastatic breast cancer. They all mean the same thing. And what they mean is cancer that's spread from the breast to other parts of the body. Most commonly, that's the liver, the lung, the brain, the bone. So when we're talking about being breast aware, it's not just the breast itself that we should be aware of, it's other parts of the body. So symptoms that you might think about if you're worried about more advanced breast cancer can be really non-specific. So feeling just generally unwell, tired, low appetite, weight loss, lack of energy, or symptoms of where the cancer might have spread to. So if you've got a breast cancer that spread to the liver, you might have pain in the tummy or jaundice, yellowing of the skin. Breast cancer that might have spread to the lungs, you might have breathlessness, a cough, repeated chest infections. Breast cancer that spread to the bone, you might have bone pain, or breast cancer that spread to the brain, weakness in your arms and legs, headache, visual symptoms. So it can be very broad. So what I would say, because I don't want anybody to be worrying that every symptom they have could be cancer. What I would say is symptoms that are new for you, that are unusual for you, that can't be explained by another obvious cause, and that don't go away, there are reasons to go see your doctor and just get an examination. And for the most part, they won't be cancer. They'll be something else. But it's just, again, being breast aware.
Thank you so much, Nalinie. You mentioned secondary breast cancer, but our audience might not be very familiar with the term. Can you explain what is secondary breast cancer, please?
Yeah, so secondary is when the breast cancer itself has spread to a secondary site. So, as I mentioned, the liver, lung, bone, brain. I think people sometimes think, if it's spread to the liver, I've got liver cancer. Actually, it's still breast cancer. It's still the same cancer cells. They've just moved to a different part of the body. And so therefore, the treatment that you have if you've got secondary breast cancer is still the same treatment that would give to breast cancer. It's not treatment for liver cancer, because that would be very different. And I think people can sometimes get confused about that. If they've originated from the breast, it's still a breast cancer. It's just gone to a secondary site. The sort of technical term is metastasized, where it's spread to another part of the body. And yeah, so our aims of treatment of this kind of cancer is not usually cure. It's about controlling it.
Thank you so much, Nalinie. Can you tell us what is the breast cancer survival? Because I think that is the one important question everyone asks, I'm sure, as soon as they get to know they've been diagnosed, or even, provisionally it could be the breast cancer. I'm sure everyone wants to know that.
Yeah, and like you said, it's so common, breast cancer is so common, but what I will say is actually survival for breast cancer is generally very good, especially if you're diagnosed early. And that's partly because women are having screening and so are being diagnosed early, and treatments are really excellent. Generally, women are surviving and having a good outlook, good prognosis if they have breast cancer. Of course, that depends on stage and risk factors. But if we're sort of grouping all our women and men together, 95 out of 100 women who develop breast cancer will survive at the 1 year point after their diagnosis. And then if we fast forward to 10 years after their diagnosis, 75%, so 75 out of 100 women will still be alive, and so will have been treated and are doing really well. And that's really good odds compared to many other cancers. That means the majority of women are surviving their breast cancer and are being treated from breast cancer and are living a long time. Even if you have stage 4 breast cancer or secondary breast cancer or breast cancer that's spread to another part of the body, people can live for a number of years. Yes, on treatment. So it's not like if you have early cancer where you have treatment that's finished after a few months and then you have, then you're well. You might be on treatment for a long time, but you might be living for a few years and can live a normal life with breast cancer. Now, as I hinted at, it depends on your stage. It depends on your risks or underlying risks. It depends on your fitness. So if you are unfit, you have lots of medical problems, you're a bit frail, you might not do as well as somebody who's healthy, who's active, who's generally considered fit. And we find that people who are active can tolerate treatment better and also do better than people who are not active. So even if you've been diagnosed with breast cancer, you might think, I need to rest and reserve my strength and keep my energies up and lie down a lot, and that will do better for me. It's actually the opposite. who've been diagnosed with breast cancer, keep active, keep doing exercise. And actually, there are lots of studies that women who've been diagnosed with breast cancer who keep active do better, survive longer, tolerate treatment better, have fewer side effects from the treatment if they're active than if they're not and they're sedentary. So there's sort of lots of factors to think about when you're thinking about survival. Overall, I'd say the outlook is good. It's generally a good cancer. And there are so many treatments available for breast cancer, unlike some other cancers where we're limited and the research isn't very advanced. I think because breast cancer is so common and something that people are very passionate about, a lot of money goes to charities and there's lots of research going on in breast cancer. So there are new treatments probably every few months coming out. And that's really encouraging and really reassuring.
Thank you, Nalinie. Thank you so much. You have taught so much about breast cancer. And I think there's no excuse for people who are listening to you today not to know about it and, to know the importance of breast awareness as well. You have said so much. For some people, it could be a lot of information. What could you say to them, 5 takeaways? They are the most important things to remember from this talk.
I think the 5 main things, and it's a bit of repetition, but I think repetition is important, is knowing what's normal for you. So if you finish this talk and you go to the bathroom and you look in the mirror and you have a look and have a feel, that's one really incredibly important thing. Having a look, having a feel. So knowing what your normal breasts feel like. Knowing what's not normal. So knowing the symptoms. And again, this will be the 3rd time I'll say it, but feeling for lumps, looking for skin changes, feeling under your armpits, looking for discharge or leaking from the nipples, or looking at a change in the appearance of the nipples. That's knowing what's normal or abnormal. And so knowing when to go see your doctor. And if you are 50 or above, undertaking screening, really, really important. They're sort of the main take homes, I'd say, of what we can do for ourselves. And actually, my last one I'll add in is being active, because that's something that we can do in our daily lives, even if it's half an hour every day of gardening or doing some chores in the house. The UK sort of, again, if we're thinking about guidelines, the UK guidelines say that we should do 150 minutes of moderate exercise or activity per week. So 150 minutes is about half an hour, 5 days a week. So not very much. And that might just be walking. It might just be going to work and back. But as long as when you walk to the train station, you walk a bit faster and you get a little bit out of breath, it can make a difference. And they're all things that we can do for ourselves.
Thank you so much, Nalinie. I'm sure we will all remember that, what you said today. And people who have missed, I'm sure they have missed a great show, but they'll go back and I'm sure listen to your talk on the YouTube. One last question. Can you share what has been your journey with this talk show and what are your suggestions, feedback or opinions?
Well, this is such an incredible forum. It's so nice to see so many faces, and it's so important that you are doing what you're doing, that we can educate people that might not have access to information without something like this talk show. And the fact that you're doing it and the fact that it's on Facebook Live and anybody can access it all around the world, I think is incredible. So I think we should be thanking you for hosting this and putting on this show every week.
Thank you so much, Nalinie. Very generous comment. Now, let me introduce the next speaker before I go any further. So just bear with me, please. Let me follow the tradition of doing it. Next week, it will be the 6th of November. It will be the Preventing and Screening Cancer with Dr. Shivan Shivakumar, consultant medical oncologist from University of Oxford. He's a cancer specialist and treating tumors of the pancreas and liver with a research interest in detecting and treating pancreatic cancer. So I think it's another important topic. We were looking for hepatic cancer a while ago, but we couldn't find. So thank you so much for Dr. Navaratnam actually for finding this speaker. Now it is Dr. Shanti Parameshwaran to give the vote of thanks, who kindly introduced us the speaker today.
Part of the world. Yes, Nalinie, you wanted to say something?
Oh, sorry, I was just going to say you're on mute.
Oh, I'm muted. Thank you for that. I'm now unmuted. I think you can hear me.
Yes, loud and clear. Yes.
Yes. Thank you all, wherever you are in any part of the world, for having come to listen to Nalinie, who has given us a very good talk. And I'm so glad, Nalinie, that you were able to speak to us on this day, which is the 30th of October, before we go into November, because October being the World Breast Cancer Awareness. So you just made it. So congratulations on that front. And as Menaca said in her speech, this is the month, Breast Cancer Awareness. Since 1985, it was declared as such, and you just made it. I think your speech has been very informative and very valuable. And I think what you said, your take-home messages, was that early detection is so very important, which leads to successful treatment. And I think that is a very important message. And also you said the early detection, who knows best your body? Yourself. And I think that was something I take home myself. And also included was some life changes you asked us to make. Eating a healthy diet, being physically active, and keeping to a healthy weight can help. Of course, drinking sensibly and moderately, and quitting smoking. I think those are also very major lifestyle changes which we can do. So thank you very much, Nalinie, for having come today. In spite of having, people may not know that you have a 7-month-old baby who, I think we had to thank your husband, Chris, for looking after the baby so that he allowed you to come and talk to us and give us this very important talk. And the message I think I wanted to say and impress on all of us is not only simply for women, you also mentioned that men too must take notice. So that is a very important thing. We must thank you for that. And the last thing is, I know you're doing a lot of research into this as it comes along. And one of the things I noticed was that you're doing the use of aspirin as well. And I was a bit saddened by use of aspirin. You know why? I'm allergic to aspirin. And I have a 2 strong family history, my mother and my sister. And just as an anecdote, my sister found a lump because she knew her breast well. She found the lump. She went to the doctor. The doctor said, no, there is no lump. But her persistence, she went on and they found that it was cancer. So she has had treatment and it was success. So thank you again, Nalinie, for coming. Enjoyed your talk. And I think we must also thank your husband, Chris, for allowing you to be here with us today. Thank you.
Thank you, Dr. Shanti.
Thank you, Dr. Shanti. And thank you so much, Nalinie. As I did know that you have a 7-month-old baby, because that's one of the first things Dr. Shanti told me when she introduced me. So yeah, thank you so much for giving up your time and coming and doing it.
Yeah.
And for people who are on the Facebook, we might almost close, but people who are on Zoom, you're going to be asking questions directly to the speaker. So please hold on. Before I do that, let me announce that on the 3rd of December, we are going to be having a live in-person event. And there are awards to grab, and I have shared it in the groups, but I will share it again on the emails to everyone once more to nominate yourself or nominate somebody else who you think is worthy. So, please do come and support us. It is for a good cause. And, this is only a first step to do the talk show. There is so much more in the plan. I don't want to talk about it. It's not the right time. So thank you so much for everyone for being here. For people who are on Facebook, we will see you next week again on our episode 108 on the 6th of November, Preventing and Screening Cancer with Dr. Shivan Shivakumar. Until then, thank you so much for everyone who is on the Zoom and Facebook supporting us week after week to be in this position, to be even able to dare to keep a live event. So thank you so much. Until we see you next week, same time, same place. Stay safe, be happy, and keep smiling.